going to be the student nurse practitioner working with you today. May I please have your name and date of birth?
Joseph D'Ambrosio, 5/17/90.
Is that the name that you prefer to be called?
Joey's fine.
Okay, Joey, so I'm going to take a seat just so I'm at your eye level. I'm going to hand sanitize my hands. The door in the office is closed, so we have some privacy. So first thing I'm going to do is start by interviewing you, and then we'll move on to your full head-to-toe assessment. So what brought you into the office today?
I'm starting to experience new migraines.
And when did they start?
About 3 weeks ago.
Where are they located?
On the back of my head on both sides.
And how long do they normally last when they do start?
About 2 hours.
Any characteristics associated with them? Any characteristics that you could explain about your migraine, such as throbbing, sharp pain, dullness?
Yeah, it's sharp and throbbing.
Okay, can you rate it from 1 being the least, 10 being the greatest?
7.
Any aggravating factors associated with it, such as blurred vision, sensitivity to light, sound?
All 3.
Okay. Any relieving factors? Do you take any medications for it? Do you feel like sleeping helps?
I've just been taking 500 milligrams of Tylenol.
Okay, and as you stated, the timing, it's been going on for at least 3 weeks. So let's go over your past medical history. Any past illnesses?
No.
Chronic illnesses?
No.
Any injuries or surgeries?
No.
Any hospitalizations?
No.
Any substance use or such as tobacco use?
Yeah, I used to smoke.
And how many years ago did you quit?
2.
How many packs did you used to smoke?
About a pack a day.
And for how many years?
About 15 years.
Okay. Any alcohol use?
Socially.
When you go out, how many drinks do you think that you consume in one night when you go out?
1 or 2.
Okay. Any daily exercising?
No.
No. Nutrition-wise, any issues eating? Do you feel like you have a proper diet? You drink enough water throughout the day?
No.
So you don't feel like you're drinking enough water throughout the day?
Correct.
Okay. Any issues sleeping?
A little bit of tossing and turning.
And when did this start?
About 3 weeks ago.
And how long? How many nights a week do you experience this tossing and turning?
3 or 4.
Okay. Are you up to date on all your immunizations?
Mm-hmm.
Do you see a physician yearly?
Yes.
What's your occupation?
I'm a barber.
And what hours do you generally work?
Usually from 8 a.m. to 6 p.m.
And what is your work setting? Is it busy, stressful?
Yeah, it's busy, stressful.
Okay. Are you married or single?
I'm married.
Do you feel like your migraines are affecting your life at all?
No.
Are you sexually active?
Yeah.
Any STDs, old or recent?
No.
Good. Any issues with stress in your life? Any suicidal, homicidal thoughts?
No.
Good. Do you take daily medications?
No.
Just a Tylenol as needed?
Yeah.
And you take that orally?
Mm-hmm.
Okay. Any allergies to medication, seasonal, environmental allergies?
No.
Good. Any herbal or vitamin supplements?
No.
Okay. Do you have any family history that you're aware of with glaucoma, cataracts, any hypertension,
No.
diabetes?
No.
Any neurological disorders?
No.
Any muscle conditions?
No.
Cystic fibrosis? Any skin cancer, lung cancer?
Nope.
Anything along those lines? Good. So next what I'm going to do is I'm going to move on. I'm going to ask you some different symptoms that you may be experiencing, or tell me if you're not experiencing them that are related. Let's say we're going to start with your eyes. As you said, you had sensitivity to light. Any blurred vision? Any pain with your eyes?
No.
For your ears, are you experiencing any ringing in your ears?
No.
Okay, good. Let's see, for your respiratory wise, are you coughing up blood or any sputum or having any shortness of breath?
No.
Cardiac wise, any chest pain, tightness, any stiffness in your chest?
No.
Good. For your musculoskeletal, are you experiencing any stiffness, muscle pain, joint pain, anything like that?
No.
Any new rashes that you've been noticing on your body?
No.
Any changes in your nails or your hair?
No.
And neurologically, you're not having any numbness or tingling in your extremities, any vertigo, dizziness?
No.
Good. And as you stated above, you are not having any stress or any homicidal or suicidal thoughts, so that's good.
Correct.
So now what I'm going to do is I'm going to move on to go over your vital signs that we got from my medical assistant, and then we'll start for your physical examination. So you had an oral temperature of 98.4, respirations of 16. You had a heart rate of 65. Blood pressure in your right arm while you were sitting was 134/72. And you have a BMI. Your height is 5'7", weight is 175, which makes your BMI 27.4, which is good. So now what I'm going to do is I'm going to move on to my full head to toe assessment. I'm just going to wash my hands. Again, first thing I'm starting with is your head. So I'm inspecting as well as palpating your scalp and your head first. I want you to tell me if you feel any tenderness. And what I'm looking for here is lesions, masses, or any deformities. And I'm also going to be looking at your hairline, okay? So palpating first. Do you feel any pain?
No.
I'm inspecting your hair. I see that your hair is evenly distributed across your head, which is good. I'm going to move on for your face. I'm going to test your facial movement. So I want you to smile, frown, puff out your cheeks, squint your eyes, and then raise your eyebrows. Good. So next what I'm going to do is I'm going to test your sensory function. I'm going to use a cotton swab. I have a dull side as well as a soft side, and I want you to tell me what you can feel.
Sharp. Dull. Sharp. Sharp.
Good. So everything looked good there. So now what I'm going to do is I'm going to palpate and do range of motion of your TMJ. So I'm going to put my hands in front of your tragus, and I want you to clench your jaw. Good. And I want you to move your jaw back and forth. Good. So everything looks good there. So now what I'm going to do is I'm going to inspect your eyes. So first thing I'm going to do is I'm going to use my pen light. I'm going to look at your eyes. I'm going to look at your eyelashes, your eyelids, your pupils, your corneas, your conjunctiva, all that stuff in your eyes to see if there's any issues there. I'm going to have you look up and then look down. I'll pull up your eyelid and look. Same thing on this side. And look up. Good. Everything looks good there. Now what I'm going to do is I'm going to move on and I'm going to assess your pupillary reaction to light. So I'm going to have you look straight for me, and I'm just going to shine my light in your eye. Good. And again. Good. And at this time I'm also looking for nystagmus, which I don't see. Now I'm going to move on to your peripheral vision. So if you could just sit back, cover one eye, and then I'm going to hold up my hands and you tell me how many fingers I'm holding up.
2, 4.
Switch.
4, 1.
Good. Now I'm going to test your extraocular movements by doing the cardinal field of gaze. And I'm going to want you just to follow my finger. Good. So everything looks good there. Last thing I'm going to do is I'm going to have you just follow my pen light to your nose. I'm going to test for convergence. Good. Moving on, I finished your eye examination. Well, actually, before I move on to your ears, I want to do a fundoscopic exam on your eyes. So what I'm looking for here is your red reflex. I'm looking at your veins, your arteries, and everything in your eyes, as well as your optic disc. So I'm going to use my fundoscope. I'm going to have you look straight, and I'm going to look in your eye and turn. Same thing, look in your eye and turn. Okay, so I see your red reflex. I see everything in there, and it looks good. So now I'm going to move on to your ears. So I'm going to have you sit. Okay. So first I'm examining your ears. I don't see any redness or swelling. I'm going to palpate them, and I want you to tell me if you feel any tenderness.
No.
Good. I'm going to use my otoscope, and I'm going to look inside your ear. What I'm looking for here is your tympanic membrane as well as your auditory canal. And I'm going to look in. I see your tympanic membrane, which is translucent, and it's intact. So I'm going to switch to this side, pull your ear up and back, and I'm going to look as well. Everything in that side looks normal as well. I do see serratum, which is just your earwax, and you just have a scant amount, which is a normal finding. Now what I'm going to do is I'm going to have you sit back just a little bit. I'm going to test your hearing. First test I'm going to do is called the whisper test. So I'm going to stand 2 feet behind you. I'm going to have you hold one ear, and I want you to tell me what I'm saying. Repeat what I'm saying.
Apple.
Red.
Red.
Good. I'm going to switch sides. Yellow.
Yellow.
Tree.
Tree.
Good. So everything was good there. You were able to repeat what I said. Now I'm going to move on to the Weber and the Renee test. The Weber test, I'm going to strike my tuning fork. I'm going to place it in the middle of your head. I want you to tell me if you can hear the sound in your right ear, your left ear, or equally on both sides.
Equally on both sides.
Good. So now what I'm going to do is I'm going to do the Renee test, which is testing your air connection to your bone connection. I'm going to place my tuning fork on your mastoid process. And then when you can't hear the noise anymore, I want you to raise your hand. And then I'm going to move it in front of your ear, and you're going to do the same thing. Good. Good. So everything with your ears looks good. Now I'm going to move on to your nose. I'm going to examine your nose. I'm just inspecting it. I see that your nose is symmetrical throughout your face. I'm going to use my pen light. I'm going to look inside your nose. And what I'm looking for here is that your mucosal membranes, which are pink and moist. I do see your septum. It's not deviated. And your nasal turbulence are intact. Moving on, I'm going to palpate your frontal and maxillary sinuses. And what I want you to do is just tell me if you feel any tenderness. This is your frontal and this is your maxillary. No tenderness. Good. Moving on, I'm going to move on to your mouth. I'm going to examine your teeth, your gums, your posterior pharynx, your uvula, as well as your tongue strength, your mucosal membranes, and your hard palate. So first I'm just going to look in your mouth. I'm going to inspect it. I see that your mucosal membranes are intact. They're moist. Your uvula is midline. I can see your hard palate as well as your posterior pharynx, and your gum and teeth are intact. So now what I'm going to do is I'm going to look at your uvula as well as your posterior pharynx. I want you to say ah. Good. So your uvula rises midline when you say ah. So now what I'm going to do is I'm going to test your tongue strength. So I want you to stick out your tongue and wiggle it back and forth. Good. Moving on, I'm going to move on to your neck. First thing I'm doing is just I'm looking at your neck. I'm inspecting it. Then I'm going to palpate your neck. And when I'm palpating here, I want you to tell me if you feel any tenderness. I'm also going to palpate your carotid pulses. Do one at a time so I don't cut off any circulation to your brain. And then I'm going to also palpate your thyroid, which I should not feel. Okay. So right now, just tell me if you feel any tenderness.
No.
Good. I'm going to palpate your carotids. Good. So now what I'm going to do too, before I move on to palpating your thyroid, I'm going to palpate all your lymph nodes in your head and your neck. So your preocular, your postocular, your occipital, your submandibular, your submental, tonsillar, your anterior cervical, posterior cervical, and your subclavicular. Any pain there?
No.
Good. So now I'm going to stand behind you. I'm going to place my hands behind your neck. I'm going to deviate your trachea to the right, and I'm going to have you take a big gulp. Good. So I don't feel your thyroid gland, which is a good finding. Now what I'm going to do is I'm going to use my stethoscope. I'm going to use both sides of my stethoscope. I'm going to listen to your carotid artery for any bruits or frills. Good. Lastly, what I'm going to do is I'm going to have you do range of motion of your neck. So I want you to do flexion, extension, bring your head up, rotation, rotate your head back and forth, lateral bending to each side of your head. Good. So next what we're going to do is we're going to move on to your lungs as well as your heart. So if you could just please remove your shirt so I can examine your chest. Good. So first thing I'm going to do is I'm going to start in the front of your chest. I'm examining your chest. I notice that you do have tattoos bilaterally on your upper chest. I do see one on your right side as well as on your rib cage. After I inspect, what I'm going to do is I'm going to auscultate all lung fields. And I want you to take a big breath in every time I move my stethoscope, okay? And let it out. So now I'm going to percuss. also gonna palpate at this time, and I'm gonna test for your tactile firmitis. So when I palpate, I just want you to say 99.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
Good. So I tested in all 6 lung fields for your tactile firmitis, which was good. So now what I'm gonna do is I'm going to move to the back of you. I'm gonna examine the back of your chest. Just inspecting first. Same thing, I'm going to auscultate all lung fields. So big breath in and let it out. So I don't hear any wheezing, no vicious breath sounds. So now I'm going to move on and I'm going to percuss in all fields again. Good. And then I'm going to perform tactile firmitis as well. And I'm going to palpate. And I just want you to say 99.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
Again.
99.
Good. So you can sit back. Everything looks good there. So now what I'm going to do is I'm going to palpate your apical pulse, which is, for videotaping purposes, it is on the right side. I am on the right side of my patient. Your apical pulse is in the second intercostal space. So I'm just going to percuss that as well as palpate. No issues there. Now I'm going to listen to all heart areas. So I'm going to listen to your apical pulse and move my way down, okay? So I'm in your second intercostal space. Move over. Good. So I don't hear any murmurs, no issues there. So now what I'm going to do is I'm going to move on to your abdomen. And we're going to be assessing that. So first thing I'm doing is I'm just examining your abdomen. I'm going to auscultate first. And I'm just going to listen to all 4 areas of your abdomen. And I'm listening for your bowel sounds, which I hear they are hyperactive, which is good. Now what I'm going to have you do is I'm going to have you lay back because I'm going to percuss your abdomen first before I do light and deep palpitation. So percuss the 4 areas of your abdomen, which are good. Now I'm going to palpate, and I want you to tell me if you feel any tenderness. So I'm going to do light palpitation first, and then I'm going to do deep, which is a little further in. Like I said before, for videotaping purposes, I am on the right side of my patient. I'm going to palpate the right side for his liver, and I'm going to palpate the left side for the spleen, and then I'm going to palpate both sides for the kidneys. And I'm unable to palpate them, which is a good finding. Did you have any tenderness?
No.
Okay. Moving on, what I'm going to test for now is for your Murphy sign, which is your gallbladder. So I'm going to hook my hands underneath your rib cage, and I want you to take a big breath in and let it out. Good. Next, I'm going to do the Turner sign, testing for appendicitis. So I'm going to internally and externally rotate your leg. Any pain in your belly area?
No.
Good. So moving on, I assessed everything up top. So now what I'm going to do is I'm going to have you sit and I'm going to inspect your upper extremities first. So right now, what I'm doing is I'm just inspecting your shoulders. I see your shoulders are symmetrical. They look fine, no redness, no swelling, no deviation. So now what I'm going to do is move on, and I'm going to move you next to me, sorry. I'm going to palpate all your joints in your shoulders, and I want you to tell me if you feel any pain.
No.
Good. So now what I'm going to do is I'm going to move on to range of motion of your shoulders. So I want you to do flexions, bring your arms up, extension, bring your arms back. Abduction is bring them up, abduction, you're going to take one over in front of you, bring it to your body. Switch, bring it to your body. Internal rotation, it's like you're scratching your back. I want you to do that with both arms. External rotation, try to touch your scapula on the opposite side and do it on the same thing. Good. So now what I'm going to do is I'm going to test your muscle strength of your shoulder. So I want you to place your arms out. Don't let me push down, and don't let me push up. Good. And don't let me push out. Good. So everything looks good there. You can place your arms down. Now what I'm going to test for is called the empty can, which is testing for any tears in your shoulders. So what I'm going to have you do is put your arms out and put your thumbs down. Okay? And then I'm going to push down. Any pain?
No.
Good. So you can put your arms down. Next I'm going to examine your elbows. So I'm just going to inspect your elbows first for any swelling, which I don't see. Now what I'm going to do is I'm going to palpate the areas of your elbow. Any issues with that? Good. Okay. So joints are fine. Your inspection is fine. Now I'm going to have you do range of motion of your elbows. So I want you to do flexion, extension. You're going to do supination, so bring your arms in. And then pronation, bring your palms up. Good. Now what I'm going to do is I'm going to have you bend your elbows at a 90-degree angle like this. And I'm going to push out, testing your muscle strength. Don't let me push out, and don't let me push in. Good. Everything with you put your arms down. Everything with your elbows looks good. Now I'm going to move on to your wrists and your hands. So just inspecting your wrists as well as your hands. I don't see any stenosis. Your capillary refill looks fine on your hands. So now what I'm going to do is I'm going to move on and I'm going to palpate all the joints in your hands. Okay. Any pain?
No.
Good. Okay. No issues there. So everything looks good there. Now we'll move on and we will do range of motion of your wrists and your hands. So first thing you're going to do flexion, extension, okay. Ulnar and radial deviation is kind of like you're waving, move your hands back and forth. Good. And now you're going to do flexion of your fingers. So down, extension of your fingers, bring them up. Abduction, spread them out. Abduction, bring them back in. And then you're going to do flexion of your thumbs. And then abduction, bring them out. And adduction, bring them back in. Very good. So everything looks good there. Now what we're going to do is we're going to test your muscle strength of your fingers. So I want you to just spread your fingers out. Don't let me push them in. Good. Now close your fingers. Now open them. Good. Now I want you to make a fist. I don't want you to break. I'm going to try to break your wrist, but I don't want you to. So good. Strength looks fine there. So now what I'm going to test for is your carpal tunnel syndrome with the tunnel and the Fallon. The tunnel and Fallon test. So what I'm going to do is I'm going to tap here. I want you to tell me if you feel any pain.
No.
On this side.
No.
Good. And then for the Fallon, we're going to put your hands together like this, and you're going to hold them like that for 1 minute. And I want you to tell me if you feel any numbness or tingling.
No.
Good. Okay. So that's good there. So now what I'm going to do is I'm going to do test your sensory function. Same thing. I'm going to use my my Q-tip, soft side, dull, little sharp side, and dull side. And I want you to tell me what you feel.
Sharp. Dull. Dull. Sharp. 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 Dull. Dull. Dull.
Very good. So everything was correct there. So now what I'm going to do is I'm going to test your deep tendon reflexes. I'm going to use my tool here, and I'm going to test your brachial reflex, and then bend your arm, and I'm going to test your tricep. Good. Same thing. Brachial, bend your arm, tricep. Good. Now I'm also going to examine your radial and brachial pulses. Very good. So they're +2. They look good. Now I'm going to move on. I'm going to examine your hips. I'm going to move on to your lower extremities. We're going to do the exact same thing. So I'm going to move on to your hips. I'm going to have you stand up just so I can look and palpate your hips. Stand for me. So I see that your hips are symmetrical. I'm going to palpate your joints in your hips. Very good. Everything looks good there. You don't have any tenderness, right?
No.
Okay, so you can sit back down. So now what I want to do is I'm actually going to have you lay back so that I can do range of motion on your hips. So I'm going to do flexion, extension. We're going to do abduction, adduction, and then I'm going to have you bend your leg. I'm going to do internal and external rotation. And same thing on this side. Flexion, extension, adduction, abduction, bend your leg, internal and external rotation. Very good. So if you could stay like this, I'm going to put my hands behind you, and I don't want you to push up. Don't let me push up, and don't let me push down. Good. Bring your legs up at a 90-degree angle. Don't let me push in, and don't let me push out. Very good. So you can straighten your legs. I did a range of motion. I tested your muscle strength, which was good in your hips. Now I'm going to move on to your knees. So what I'm doing here is I'm looking for, looking at your knees. I'm inspecting them. I don't see any issues there. I'm going to palpate your knees. Any pain when I palpate?
No.
Good. So same thing, we're going to perform range of motion on your knees. So I'm going to actually have you sit down. Bring the chair back to the side. I want you to do flexion, extension, bring the leg out, okay, flexion on that zone, and extension. Good. So everything on your knees looks good. Don't let me push down. Good, and don't let me push up. Very good. That looks good. So now what I'm going to do is I'm going to have you lay back again so I can examine your ankle and your feet. But before I do that, I'm going to do the Lickman test, which is testing for any ACL tears. So I'm actually going to pick up your leg like this. And your femur and your tibia, I'm going to try to pull them apart. Any pain?
No.
Any pain?
No.
Good. All right, so moving on to your ankles. Examining your ankles for any edema, any rashes. I don't see anything like that. So now what I'm going to do is I'm going to palpate your ankles as well as your feet. Any tenderness, any pain?
No.
Good. I don't see any stenosis of your feet. Your calf refill is fine. So now I'm going to have you perform range of motion. So I want you to do flexion, dorsiflexion, plantar flexions, point them out. I'm going to do inversion, bring them in, exversion, inversion, exversion. Good. Now I want you to push down on my hands. Good. Don't let me push down, and don't let me push up. Good. Strength is good bilaterally in your feet. So moving on, I'm going to test your deep tendon reflexes, and then I'm going to move on to your pulses. So deep tendon, I'm going to do your patellar reflex. So if you could just actually bring your legs down. Good. And sorry, do it again. You're going to have to come back up just so we can get it in the camera. For videotaping purposes, I'm going to do your Achilles. Good. So you can stay like that. I'm going to move on, and I'm going to assess your pulses. So your your popliteal pulse, your posterior tibialis, and your pedal pulses, which are all +2. Now I'm going to move on. Same thing. I'm going to test your sensory function. Tell me if you feel dull or sharp.
Sharp. Sharp. Dull. Dull. Sharp.
Very good. So last thing, if you want to stand up, we're going to test your gait. So I'm going to have you walk across the room, and I'm going to examine your gait, and then you can walk back. Very good. If you can just stand in front of me. I'm going to have you stand with your eyes open. Just stand there with your arms by your side. Now I'm going to have you close your eyes, and what I'm testing for is the Romberg test. So stand by your side, close your eyes. Good. So I noticed some swaying, which is a normal finding, which is fine. Now what I'm going to do is I'm just going to stand behind you, and I'm going to inspect and palpate your spine. I'm going to palpate your cervical, your thoracic, as well as your lumbar area. Any pain or tenderness there?
No.
Okay. Now what I'm going to do is I'm going to have you do range of motion. So if you could just do flexion, bend forward, extension, bend back, rotation, and lateral bending, side to side. Very good. So now what I'm going to do is I'm going to have you sit back down. I'm going to have you do the heel to shin test. So I want you to bring your heel, slide it down your shin. Same thing. Good. I'm also going to have you do the, I'm going to have you lay back and I'm going to test the Brzezinski sign, which is testing for meningitis. So what I'm going to do here is I'm just going to pick up your neck, see if there's any pain, any tenderness, any issues there.
No.
Which I don't see. So you can actually sit back. I'm going to test the finger to nose test. So I want you to use your finger and touch my finger and then touch it back to your nose, okay? Very good. And then the rapid movements, rapid alternating movements. So I want you to smack your hands on your legs and go faster. Very good. So that wraps up our assessment. What I think that your migraines are associated with is lack of sleep, stress in your environment, as well as dehydration. So the plan would be to go home and drink some more water, and then we can follow up with you in a couple weeks if you still have these migraines. So I hope you have a good day. It was nice meeting you.